In this training, the team will set up and tear down a root canal treatment using a fully color-coded system for materials and instruments. By standardizing with color, the clinical team reduces setup time, avoids missing items mid-procedure, and minimizes unnecessary steps and motion in the operatory. The focus is efficiency. Fewer trips to central sterilization, less hunting for supplies, and a smoother experience for the patient and team. The color-coded system means every instrument setup is complete, every material is accounted for in the tub, and everything is exactly where the team expects it to be every single time. Start in central sterilization. Locate the custom color chart and identify the root canal treatment color. Here, everything for root canal treatment is organized in the same color tub, cassette, and tray. In some storage solutions, a procedure cart can store all root canal treatment items. In the root canal tub, keep all procedure-specific materials needed for most cases: hand and rotary file sizes, irrigation syringes and tips, paper points, gutta-percha cones, temporary filling material, and other common root canal materials. In the cassette, keep all the instruments needed for the root canal treatment and place the cassette on the corresponding colored tray for high-efficiency, ready-to-use sets. A typical root canal treatment setup might include mouth mirror, explorer, cotton pliers, endo excavator, rubber dam forceps, clamp, endo ruler, endo pluggers and spreaders, and a small assortment of hand files or rotary file in a color-coded root canal guard, in addition to anesthetic syringe, bite block, and extra materials. When team members grab this tub and tray, they know they have 90% of what they need for any root canal treatment, regardless of the tooth or provider preference. The rest is retrieved without wasting time, sifting through multiple drawers, cabinets, or places. The color gives a visual cue for what this treatment room is being used for. Neon blue is root canal treatment. Any team member can know what procedure is being performed simply by glancing in. If this were a restorative procedure, the tray and tub color would be a different color. Treatment room preparation is expedited when it is divided into 3 working zones: doctor zone, shared zone, and assistant zone. Doctor zone. This is the space where the provider has to reach for items only they use when in that position. Handpieces, burr guards, a space where they put their instruments and cotton products. Shared zone, the space between the provider and dental assistant. This space is designed for items that both the provider and dental assistant need to have access to: shared instruments, cotton products, or materials. And the assistant zone. This space is for the items the assistant only needs to have access when in that position: irrigation rinses to refill syringes, additional materials to refill for the procedure, or general disposables when needed. Next, bring the tray setup and tub into the operatory. Arrange the cassette and tray in the shared zone and the colored tub in the assistant zone. This keeps frequently used materials within arm's reach and minimizes turning away from the patient. Prepare the room for patient care. Intentional placement in standardized treatment rooms make room preparation efficient and predictable. Prepare the room for patient care according to your practice's protocols and CDC recommendations. Open the tray and pouch. Arrange instruments and cassettes to support the order of use for the procedure. All instruments can remain in the cassette and be retrieved as needed for the procedure. Rubber dam components are split between the cassette and the tub. The instruments, rubber dam forceps, punch, clamps, and frame live with the cassette. Dam sheets live in organized compartments in the tub or procedure cart. Because the placements in zones are the same every time, the assistant can anticipate the next step: clamp, dam placement, frame, and check for isolation, all without pausing to search drawers. Remove the tub cover to retrieve files and prepare the endo guard with the requested file lengths and sizes, and place it in the doctor zone of the clinical space. Leave the tub cover off during setup. Standardization of general disposables in the treatment room creates additional efficiencies in the setup of the procedure. Providers can retrieve commonly used items without hunting for supplies that are needed on mostly every patient. Place an appropriate amount of disposable products in the preferred zones for each provider. Begin to retrieve materials known to be used for the procedure from the procedure tub. Place items together in order of operations for the procedure, which will create an efficient flow of materials and prevent back and forth movements of the assistant. Leave any additional items in the tub for easy retrieval if needed later during the procedure. Put the cover back onto the procedure tub in the unlocked position to avoid contaminating during the procedure. Equipment needed for the procedure can be located in an equipment station or cart. In this case, the equipment is stored in the dedicated equipment cabinet in the treatment room. Keep rotary handpiece, apex locator, and gutta percha warmer grouped together in the correct working zone and in position of order of operations. Grouping by order of operations prevents crossing over the field to reach for items and wasted time. Everything the team just prepared prevents mid-procedure trips to the drawers or supply areas, keeping the team fully focused on the patient. Instruments are retrieved directly from the cassette and passed directly to the provider, then placed back in the same spot when finished being used. Files are stored in size order in a small holder that matches the root canal treatment color. The provider can move from small to large sizes without losing track because everything returns to its exact slot. If additional items are needed during treatment, simply lift the cover of the tub, use clean cotton pliers to retrieve materials, and return the cover. Leaving the tub cover unlocked allows for this quick and easy access. After the procedure is complete, dispose of all single-use general disposable items into appropriate waste or sharps containers. While still in the treatment room, return the banded and/or taped instruments back to the root canal cassette, locking all instruments inside, and place the cassette and any loose instruments on the tray. place the cover on the tray and in the locking position. This will provide compliance and safety when transporting contaminated instruments back to sterilization for reprocessing. Any single-use, procedure-specific items will be disposed of, while reusable or multi-dose materials will be disinfected and returned back to the procedure tub. Disinfect items according to the manufacturer's instructions and CDC protocols. Each material has an intentional place in the tub and should be placed back in its original spot. Once all the materials are properly disinfected and put in their respective places, the tub cover can be replaced and disinfected. The endo equipment is disinfected according to the manufacturer's instructions and CDC protocols and placed back onto its charging dock or stored in centrally located space for procedure equipment. Transport closed cassettes to the reprocessing area and place disinfected tubs back to the clean storage in central sterilization. We hope this video provided you with efficiency tips to streamline your root canal treatment procedures. Consider mapping all of your major procedures to specific colors, then build cassettes and tubs that match. The investment in setup pays off every day in efficiency, safety, and reduced stress.